At what point would you say a parent should seek outside help if they think they've tried to talk through something with their child and they're just still grappling with this overwhelming anxiety? When should they seek professional help?
Absolutely. When they feel that the child is continually having, again, significant discomfort and distress, they're unhappy with how they are, and they're saying, I've tried mommy, I've tried daddy, and I can't get through this, or I don't know what's wrong with me, or I don't know how to get over it. And they're continually, again, feeling kind of negative or down on themselves or their situations. So significant ongoing distress that they express, either directly with their words or indirectly, remember, with their aches and pains or their behaviors. And especially when that starts breaking down their ability to do their job on a daily basis, their ability to get up and go to school, focus on their homework, interact politely with others, have friends, show interest in activities, get about living their life. And when we see that they're having too much distress and there are too many breakdowns in daily functioning, then absolutely get some professional help sooner rather than later.
What would you say to a parent who might be concerned that if they go to seek professional mental health care, that their child is going to be prescribed an antidepressant and that will be the end of their treatment?
Certainly I would want parents to be aware and concerned of that and take it up very directly with your mental health provider. The good ones are not going to do that. In fact, we're really empowered more and more, again, with self-care strategies, cognitive behavioral therapies that are very effective, and especially what we call third wave or newer CBT, cognitive behavioral therapies that include ACT, acceptance and commitment therapy, and mindfulness-based cognitive therapies. So we have such a beautiful repertoire now of reintegrating and calming the mind and body with natural, simple brain practice, mental practices. There's nothing mystical about it. There are simple ways we can practice and retrain our brains to react to stress that have nothing to do with medication. Then there may be kids that are severe enough where any of those practices aren't able to fully take hold, where medication absolutely may improve the quality of life and be the right answer. So you want a well-reasoned consideration. It's never, oh, let's medicate a kid always or right away, or let's never medicate a kid. Let's think about when and where that might be a particularly useful avenue. But it's really, there's so many things we can do without medicines today. It's actually a very exciting time.